Some people might also feel guilty. So that's going to work bearing in mind if you know someone who's been told they've got diabetes. They might be feeling all those things.
What is the precaution measures to protect ourselves in future? Or what is the dieting system we're supposed to follow in future?
The best is to follow not to try and reduce your chance of getting diabetes. That's the same. Okay. So things like watching what you're eating, a healthy diet. So you can still have chocolate and sweeties and cake. You can still have all those things.
Well, dieting
But
system.
less of them. Okay? Keeping yourself active, physically active, whether that's walking, sports, or going to a gym, any of those things. And getting the things like your blood pressure and things regularly checked at the GP. But they would be keeping an eye on your health.
What about the dieting systems? It's better to follow the dieting systems.
A wee bit slower. What about
Dieting systems.
dieting? I wouldn't say there's any particular diet that you should be following. It would be just more, I would say, a general healthier diet. Not a lot. Don't use lots of oils and things when you're cooking. And grill things instead of frying them. If you see fat on meat that you're going to eat, cut that off. Those kinds of small. And it's because your body cannot make insulin. It cannot make it. Doesn't matter what you do, it cannot make it. So then you've got to get an injection to give you insulin. Type 2 is when your body can make insulin, but it's either not making enough or it's not using it properly. There's something wrong inside, it's not using it properly. Type 1, there's no insulin made at all. And type 2 is there, but for some reason your body's not using it the way it's meant to. Okay? Anything else about the last couple of days, about what you've learned?
So which age is supposed to be inheritance? Which age is not?
Type 2 is the one that is for the family history. Type 2, so that's the second one. So and it would be mum or dad, a brother or sister, so an immediate blood relative, you're more likely to get diabetes.
Which age would you say or after 60 would be inheritance? Your age is under age, under 60.
Not necessarily. It could have nothing to do with it. It might not. You are more likely to get diabetes if someone in your family has it. And if you're African American, you're over 25, so even under 30.
After it will be okay, and now a woman,
That is one of the only exceptions. Some women get diabetes, it's called gestational diabetes. You get diabetes when they're pregnant. And they can have the baby and the diabetes goes away. That can happen in some cases when women are pregnant. But generally, if you get diabetes, you have diabetes. That's the only case. It just disappears and never comes back. Sometimes it doesn't disappear, sometimes the woman has it.
so she has to take the medicine.
It would depend. Sometimes it depends on how bad it is. Sometimes the doctor can manage it by just somebody being there for the reason for everything.
That kind of diabetes,
And a woman,
not someone, every time as soon as we do that, so what is the danger of that kind of diabetes in the future of that woman?
and the woman, she's at a higher risk of getting a type 2 diabetes when she's older, but not necessarily so. And I don't know why it happens to some pregnant women and not all pregnant women. And it means there's anybody else. It's not about that last night.
Why the diabetes happen? How we don't know the science
Well, were you here yesterday or the day before?
No.
Because they were learning about that
Oh,
on the other day. And then it was something to tell you, I don't know. The Baltic, what they say about the Baltic water is in particular touch of fruit water. The bottle about that size. We were doing it again yesterday. We were guessing how much sugar was in different foods. So it was a bottle of water that size, touch of fruit, strawberry flavour. Say a bottle of water. Would you think there would be sugar in that?
I know a lot of research of calories.
Right, so
I think there is a lot of calories.
there is a lot. There's 18 teaspoons of sugar in that bottle of water. It's one of the highest. There's actually more sugar, I think, in Scotland touch of the water than there is in Coca-Cola. So there is. So you're, believe it or not, yes, there's a lot of sugar in it. Other flavoured waters seem to be a lot better. I don't know whether, but I think actually one probably family thinking that has to do. Anyway, so I don't know why it's their water that's so sugary.
There's, so many people culturally think the heat is being just caused by sugar.
A lot of people
And
think
what is the amount of risk of diabetes? Use sugar or red meat?
it's not sugar that causes
Which
diabetes.
one is the danger? Red meat or sugar?
Red meat or sugar. It's both. If you're eating too much of both,
Meat isn't good for that.
no, it's not. If it's not, it's the fat I'm thinking about.
Right,
meat.
okay.
Okay, so if you're eating too much sugar and too much fatty foods, so if it was red meat, it's very fatty, okay, or oil and things. If you're eating too much sugar and too much fats, you're going to get overweight. It's what causes you to become overweight, it puts you at risk of getting diabetes. So if you ate sugar and nothing else, just sugar, it would mean you get diabetes. It's not the sugar that does it. It's eating too much. Eating too much meat, anything like this. Whatever you're eating is making you overweight. That's what's giving you diabetes. That's causing diabetes.
That means underused calories in your body
Yes.
cause diabetes.
Underused calories in your body, they store in your body as fat.
So it's
So
fat.
predominantly here in men, and in women here and here. That's where the predominant in women. But in men, it's predominantly around the tummy area. If you eat too much and you don't use it up, it is converted and stored as fat in your body. What else would happen to you? Do you think if you had all this fat stored in your body? What do you think it would do to all your other vital organs?
Shut them
You've
down.
got all these other vital organs all in this same space here. You've got your kidneys, your liver, your heart and lungs is there as well. Your pancreas is there. You need all those to survive. What do you think would happen to them if you had this big storage of fat?
Does it squeeze them together?
Yep, that's what happens. They all get squashed. Right? So basically get squashed in, and some of the actual organs themselves get covered like in a layer of fat too. So it's very difficult for them to function normally. They don't function properly. They can't work properly. If you get squashed into a corner, you wouldn't be able to function properly either. If you were all, so the blood isn't flowing through the organs properly if they're compressed or squashed in. So that's another reason that it's not good to be carrying a lot of weight, especially that's a more dangerous area to carry is round the middle, round the split up in the abdominal cavity, where the tummy. That's the most dangerous place to carry extra weight. So if that's where you've got it, that's when you need to get doing some exercise and eating a little less. Pardon? Small stomach. That,
How many sugar? Too much sugar?
what do you mean? If it's too small and you're wanting it, or if you're wanting, do you mean if you're wanting, you feel like you're underweight and you're wanting to
what is the stomach supposed to be? Is that releases, I think?
Does anybody still have a tape measure from last night? No. Harriet, you don't have to have that tape measure in your bag, do you?
No, I've not got any.
I brought some last night, and it was three measurements, and for people to measure and told you what your tummy should be. However, I don't know, they all get taken last night.
I can pick, if you've got any spare, I can pick them up
Yes,
tomorrow and I can drop
Oh,
them.
there we go.
Ah,
Here we go. These two are the right in men. You want to put it right, so there's one side for men, another side for women. This is the men's side. Is it okay for me to measure?
Yes.
So round the middle and not round the hips. Okay, so yours is right there. Yours is right there. If your tummy grows any bigger, you're coming at risk of getting diabetes. So you're right on the borderline. That fair? You see that? So, looking at you, if you don't think, no, he's not overweight, he's not overweight. But if he grows any more, then he will be becoming at risk of getting diabetes.
More sugar, more things that
Okay?
You don't know about this?
Slightly smaller. So you're there. So you're there. So if you get in here, that's good. If you get bigger, you come up here, then this is too big. Nope, that's good. Did everybody else measure themselves last night when they got a retake measure? I will leave it here, and if anybody wants it done, I'll do it for them. See once for, after we finish the question, we'll do that at the end. For anybody that wants it, is that okay? Yeah?
Yeah. What is
Height of your BMI.
What?
Your
For
BMI.
example, on me, so that one. So that
So it's your weight divided by your height. It's a funny calculation to work out your BMI. You do it on the internet. Use the internet.
the way
See if you calculate, see if you go on the internet and say calculate my BMI. If you tell it your height and your weight, it will do it for you. Right? It'll do it for you.
over the
So if you're over the calculations, if you're over 25, if you're over 25, so your age, so your BMI, then that's you becoming overweight. It's very easy. 25, very easy. Okay, right. So if you need any help with your diabetes, we have, and this one is if you have diabetes. This is for people who have diabetes. It's about the 15 things that the NHS must give you if you have diabetes. You must be getting certain checks. You must be getting your blood pressure checked. You must be getting your eyes tested, your kidney function, your blood cholesterol, your blood glucose levels. There's several things that your doctor must do with you if you have diabetes. And that really tells you about that. Okay? All done? Thank you very much, gentlemen. If you want, where does that mean? If you want your basic measures for me to check, I'll do that before I leave. Come on, but you're happy to chat amongst yourselves or get whatever you want. Let's get, what's going to happen? There's going to be something you go, oh no.
Can I say quickly as well, thank you very much for the time since Monday up to today that you've given us. I really appreciate it. And tomorrow is the actual final day. This is finished in here, but I don't want to say like 18, but so you don't need to sit in here. You've been very patient Monday to today. Tomorrow, people who use mountain bikes, Could you put your hands up? Does anyone cycle here?
Does anyone know? Does anyone know how to cycle?
Because what's happening tomorrow, I have hired 8 places for people. There'll be transport provided as well to take you not too far from here. The place is called the bike station. Now what the bike station does is all the basic bike maintenance. So especially in the winter, if you're on your bike and something happens, tire, chain, gear, and you don't know how to do all these things, it's a bit of a problem. So these guys are going to teach you from 6 o'clock to 2 o'clock. You don't need to bring a bike. They'll give everyone a bike there. 8 people, though, not everyone. 8 people. And they'll give you a maintenance kit, which I think you might be able to take with you when you go home. Or it will teach you for 2 hours every single thing that you need to know about basic bike maintenance. So if I could get maybe some names, I've already got 3 people confirmed. Another 5 people, if they're interested, can let me know. And the transport will be from here, take you to the place, and can be up here again.
I'm not biker, but when you're going to do that, what exactly will it take for
Please do, please do.
Hold on, sir. Can you come and stand here? Please.
Anyone who wants to actually do it, you can give me your name. 6 o'clock to 8 o'clock. 6 p.m. to 8 p.m. And it's not far from here. You pick them up and take
يأتيكم في محل يدربوكم كيف يصلح العجلة حتى أنه الويند راسي جاي كذا وفي النهاية وقتكم ذاته يدوكم يعني البيرات تشيل معهم من تصلح العجلة
لما هيجيب عجلة
It starts 6 o'clock to 8.